Our routine today consists of low back pain exercises, while we talk about some tips for exercising with low back pain. Welcome or welcome back. I'm Tess, physiotherapist. In the previous video, we covered pain relief exercises for low back pain and touched on some myths of low back pain. This routine moves on from pain relief exercises to mobility or range of motion exercises. Mobility exercises form part of a rehabilitation program and are typically a progression from pain relief exercises, with the aim of increasing range of motion or mobility of the lower back. By the end of this video, you're going to know how to complete a routine of mobility exercises for low back pain, as well as some tips for exercising with low back pain. Let's get started. The first exercise is seated extension. Sitting with your back against the backrest of the chair, look up toward the sky and arch your back. Come back to rest your hands on your knees. Repeat 8 times. The exercises in today's routine are tailored toward chronic non-specific low back pain. Before starting any exercise, it is important to understand the nature of your pain by having an assessment from a medical or healthcare professional. If you are unsure if you can participate in exercise, make sure to consult your medical or healthcare professional first. With the exercises in this video, feeling some stiffness is normal. However, you should not feel any sharp or severe pain. Again, reaching up toward the sky and then bringing your hands slowly back down to your knees. From the side view, we can see the back arch as we reach up. The second exercise is seated flexion. Sitting on a chair, reach your arms toward your toes. Come back to bring your arms to your knees. It is okay if you can't reach your toes. Reach to a point that feels comfortable. Again, you should not feel any sharp or sudden pain. Repeat 8 times. The exercises in today's video are range of motion exercises. The aim of these exercises is to improve mobility or the range of motion of the joints of the spine. The first tip for exercising with low back pain is to have a graded exercise program. A rehabilitation program will include exercises that have different focuses. These typically include pain relief, mobility, and strength. A graded program will most often start with pain relief exercises, with mobility and strength exercises added in over time. The intensity or duration of exercise may also increase over time. Pain relief exercises can be found in the first video of the series, linked in the description. Again, reaching down toward your toes and come back to bring your arms to your knees. The third exercise is seated rotation. Sitting, turn at your shoulders to the right. Repeat, turning at your shoulders to the left. Repeat 8 times. The second tip is to incorporate cardiovascular exercise into an exercise routine. A rehabilitation program will typically involve specific exercises for the lower back. This may mean other exercise, such as cardio, may not be the priority. When possible, and as pain and your rehabilitation program allows, aim to incorporate some cardiovascular exercise, such as walking, cycling, or jogging. Including cardio ensures a well-rounded program for overall health, longevity, and injury prevention. A well-rounded program is particularly important when experiencing chronic pain to counteract some of the negative impacts of chronic pain, such as low mood, social isolation, and reduced activity. Again, turn at your shoulders to the right. Repeat, turning at your shoulders to your left. The fourth exercise is lateral flexion. Sitting, with your arm by your side, reach down toward the ground with your right hand. Repeat 8 times. You should feel a slight stretch on the left side of your body. The third tip is to continue regular activities where possible, such as work, seeing friends and family, and hobbies. Keeping engaged with regular activity can be a lot harder with low back pain, especially chronic non-specific low back pain. However, the importance of continuing activity should not be underestimated. Research from Hurwitz, Morgenstern and Chiao concluded that participation in recreational activities was associated with reduced low back pain, related disability and psychological distress. Repeat with your left hand, reaching down toward the ground. Again, only reach as far as comfortable. This time to feel a slight stretch on your right. One way to continue regular activity is to modify tasks. This might mean reducing the duration, taking breaks, or using equipment. For example, going out with friends for dinner for an hour rather than 3, doing short intervals of housework at a time, or using a reacher to pick objects off the ground. It may also mean giving up some activities to participate in others. For example, using online shopping or grocery delivery to save time and energy, which could be then used for going for a walk outside. And lastly, finishing off our routine by reaching up to the sky and then coming back down to rest your hands on your knees. In summary, this routine covered some common mobility exercises for chronic non-specific low back pain, as well as 3 tips or principles for keeping active with low back pain. Tip 1 was to have a graded exercise program, often starting with pain relief exercises and adding in mobility and strength over time. Tip 2 was to incorporate cardiovascular exercise when possible for a well-rounded program to support longevity. And tip 3 was to participate in regular activities such as work, seeing friends and family, and hobbies for psychosocial well-being. I hope this video has been helpful. If you would like to refer back to the exercises or tips within this video, the accompanying article can be found on the BHlth&RehabSc website. To continue to manage pain, build strength and gain fitness in the meantime, watch these videos here. See you next time.